In today's video, I'm going to tell you guys how I passed the NCLEX. And if you guys are new to the channel, my name is Gabriel Torres. I am a nurse. And if you haven't already subscribed, please do so, because I will come out with weekly content that's going to help you in all aspects of nursing. There's 4 toolkits, 4 techniques that help me pass the NCLEX and get through almost most of the questions, So number 1, and I'm sure this is all going to be review, it should be at least, is going to be the ABCs. The ABCs, airway, breathing, circulation. So this is going to be a good toolkit for when you come across a question that is an emergent question. So if you have an emergency question is, patient has epiglottitis, patient has stridor, anaphylaxis, somehow the airway is compromised. That is going to be airway. So an ABC type question. So whenever you come across a question like that, you're going to use the technique of ABCs. And sorry, I'm going to be looking down at my notes here. So when we have something like that, we're going to be, the first thing you're going to do is perform an action that's going to help take care of the airway. And then, keep going. If there's something wrong, if the airway's fine, something wrong with breathing, then that'll be the first action we would do. Number 2 of the 4 tips I'm going to give you in this video is going to be knowing and understanding the spectrum of stability. So spectrum of stability, this goes from unstable all the way to stable patients. So this is a good tool, testing tool to use for when you have a question that is asking which patient would you assess first, which patient do you send home first, which one do you discharge. So you want to, what the question is asking is if you can understand which patient is most stable and which one is most unstable. So usually the unstable ones, we're going to send down to ICU. The stable ones, they're good for discharge. So you just want to be able to understand the spectrum of stability. So this is going to be the second toolkit, because if the patient doesn't have an ABC priority, the airway is fine, the breathing is fine, the circulation is fine, then this is what you would use next to answer the question. So this is good. The spectrum of stability is good for when the question is who will you see first, who will you discharge first, something along those lines. The third toolkit that helped me was the Maslow's hierarchy of needs. So I'm sure you guys got this, the first day of the nursing program. Maslow's hierarchy of needs. So, the first one, it's not safety. A lot of people think safety is number 1. The first thing is the physiological needs of the patient, This is going to be like food, water, shelter. And then the second one is safety. The third one is love and belongingness, and then esteem, and so on. So this is going to be the third toolkit, because if ABCs are fine, if, it's only one patient, so you don't have to assess whether they're stable or unstable. The third one you can use is Maslow's hierarchy of needs. And this is also great for mental health questions. So whenever you get a mental health question, you can go through the Maslow's hierarchy of needs and see, okay, is the patient fine physiologically? Is the patient fine? Is it a safety question? Patient is not eating, they're anorexic, then we need to care for the physiological needs, not the esteem needs, and maybe we need to give them fluids. So the Maslow's hierarchy of needs is the third toolkit, because that is what you'll use if the other 2 are not being utilized for that question. The nursing process, or what I like to call ADPI. So assess, diagnose, planning, implementation, and then evaluation. So this is going to be, and the same thing, it's in the 4th, because if all other things are fine with the patient and you come down to, and the patient is a stable patient, then we're going to be using assessment, the ADPI, the nursing process. And so when assessment, it may not be so blunt and say assessment. It could say auscultate, percuss, palpate. Those are synonymous words for assessment. So whenever you see that, know that that's an assessment intervention. And so in the question, if it tells you that the nurse already assessed, then obviously your action is not going to be to perform another assessment. But let's say it gives you in the question, it says something along the lines as the monitor says something, then in that case, you haven't assessed yet. Assessing is always assessing the patient. And then, so if it tells you that there's a diagnosis, then you could just, what's after diagnosis, and that'll be the planning, and then so on. If you get an implementation, then what they're looking for or asking for is if you could distinguish which of the answers is the evaluation. So those are the 4 things. Number 1, your ABCs. Number 2, your spectrum of stability. Number 3 is going to be Maslow's hierarchy of needs. And then number 4 is going to be the nursing process, ADPI. And so these are the 4 things. If you can master these, then you will be able to answer nearly all the questions. And this helps a lot too if you do not entirely understand the disease process, or maybe even the medication, or the main part of the question. If you still don't understand it, but you still have these toolkits, you will be able to answer it right. Have faith and have confidence in yourself. So just 3 things I just want to add. If a patient is ever in distress, it's an airway problem or something like that, don't assess. I know, because you look at the ADPI and assessments first, but when the patient is in distress, do not assess. Perform an action. That is a big something huge to just have in the back of your mind, because you're going to come across a few questions that maybe they're asking something along that it's people get caught up. It's like, oh, I see assessment, that should be the right answer, when in reality, if the patient is in distress, we do not assess, and that's what the NCLEX is going to be checking, if you understand that. Okay, the second big thing, if it's ever an emergency, an emergent, out of the 4, which one should you use? ABCs. Emergent, use ABCs. Emergent, use ABCs to answer the question. And then the third last tool, I kind of mentioned this earlier, we always prioritize the patient over the equipment. So monitor says asystole, let me go look at the patient. Monitor says VTach, let me go look at the patient. The monitor tech tells you it's asystole, still let me go look at the patient. So always the patient over the monitor. And I believe with those main 4 tools that you will be successful. So if you like this video and you believe this is going to help you pass the NCLEX, please like the video and subscribe. All right, see you guys next time.